that always bothered me is how many people feel completely stuck after countless doctor visits. They're still in pain, still frustrated, and yet nothing seems to be helping them.
You're so right. It's heartbreaking, especially when you know that there are so many more effective ways, holistically speaking, that are solutions that can really help them. In fact, if you're one of the people feeling stuck with chronic pain or unresolved system, then stop what you're doing and stay with us because we're going to dive deep into some holistic alternative medicine remedies today.
That's right. In today's episode, we're exploring holistic healing remedies that can help you finally find relief when traditional medicine isn't working. Welcome to the Empowered Health Dialogues podcast. I'm Tracy, your nutritarian health coach.
And I'm Dr. Taj. I'm a dentist and a certified health coach. So let's dive right on in. Our whole mission when it comes to what we do is we want to just help people just overcome their health issues naturally, outside of kind of the medical system, the conventional medicine, where you can do alternate medicines or natural solutions to overcome physical, emotional, mental, family, spiritual health struggles. And that's what it's all about. It's about living a longer and better life. And there's so many, and I think one of the biggest problems that we see is that people have a lot of chronic physical pain and they're frustrated with the fact that they can't figure out what's going on. So when they go to the doctor and they get diagnosed with different tests, they don't come back and say anything.
Yeah, yeah. I know people who are in that boat right now. They're losing a ton of weight, and the doctors can't figure out what's wrong with them, and they've been running tests, all kind of tests. And this person is under 30 years old.
Wow. Yeah, I mean, losing weight
They
or they,
can't figure out what's wrong with them at all.
I sometimes people don't know, they can't sleep. Like, well, what's going on? Why can't I sleep? They have problems exercising because of chronic pain.
No energy, right? They have all this inflammation and they can't figure out where it's coming from,
Yeah.
right? And they don't know what to do about it. It's like they're running all these tests and they can't figure out what it was causing it.
And that's where they talk about the practice of medicine because there is no definite solution to the problems. And so they practice different theories or different things, hoping for the best outcome. So they're practicing medicine on you. So you're basically a big test,
Yes.
a big study.
Yeah, we were having a conversation about this the other day, how they're just throwing medication at you to see if this will work, see if that will work.
Yeah.
And if it interferes with other medications or it makes you feel a certain kind of way, oh, let's take you off of that and put you on this instead.
Higher dose, lower dose, change it up, go here, do this combination. That's exactly what it is. And it doesn't work.
It doesn't work. Some people will get temporary relief, but then it comes back, so then they dial up the dosage.
Yeah. And what happens is that's what leads to anxiety over how good you feel.
I believe
The
it.
frustration because you don't have this clear diagnosis of what's really going on and the doctor don't know what's going on and you leave there with no clear
Solution.
vision solution.
Yeah, yeah. Well, they think getting the pill is the solution.
Yeah, well, a lot of people have big conditions, but when you're going through it, you kind of realize, hey, what am I doing? It's just
Yeah.
not quite working.
Yeah.
Now, some people get something, oh, yeah, I feel good, I'm keep on doing whatever else, but then it always creeps back on you and come back to bite you in the rear end or in the future. But another thing that when the people know that there's something just not right, there's a feeling of being dismissed by these medical professionals.
Oh, yes.
Like, oh no, I don't see anything wrong with you. It's all in your head.
Yes. Yes. I've seen that.
And people know, what what your body feels like. You know when you're feeling your best. You know when you're not, and you have to listen to those warning signals.
Yeah. I remember when I couldn't sleep for a while, but I was having anxiety. And instead of talking to the practitioner, the problem was I wasn't sleeping. And because I wasn't getting sleep, I was having anxiety. And it was other issues that was happening around us during, 2020.
Yeah.
And it was all stress related. So instead of saying, well, you need to back off of the news and et cetera, yada, yada, instead, oh, here's a pill for sleeping.
Yeah, and so you think about how you felt. I'm pretty sure that emotional burden and the impacts on your lifestyle, my gosh, I mean, I just recall you had this growing sense of anxiety about your health was just going downhill quickly.
Mm-hmm. Mm-hmm.
I yeah.
I remember that. And I couldn't figure out what was going on, but then when they looked at all my blood work, everything looks great.
Mm-hmm.
Everything looks fantastic.
Mm-hmm.
You look into your eyes, they run a just because of my age, an EKG, and everything looks great.
Mm-hmm.
But then why am I feeling this way?
Yeah.
And they couldn't help me, and they couldn't figure it out. And it's like, well, maybe if you take this will help with the anxiety, but then this will help with the sleep, but don't take it. If you can't wake up in the morning or you're too tired, maybe we'll back off of it and we'll just do something else. And it's just like, wait, what? So you want me to take something to hype me up, but then you want me to take something to bring me down?
Yeah. I mean, I remember going through that, and that was kind of before we became health coaches,
Yes.
and I remember, I mean, you going through that, just the stress that you had, how it was affecting, our relationship,
Mm-hmm.
the relationships with other people, your friends, your
Mm-hmm.
family,
Mm-hmm.
just over your overall family responsibilities.
Yes, I couldn't really do the things I wanted to do. Remember we were in a carpool and I couldn't even drive some of the kids in carpool. I felt awful
Yeah,
because it affected me that much.
yeah. I think luckily too is that we sought the natural way.
Yes.
You start feeling better. That led us on the path we're on now. But
Yes.
for a lot of people, it only goes in one direction. It goes toward more conventional medicines.
Correct.
And so now you add not only the stress of family responsibilities, but now the financial stress from the ongoing medical treatments and medications.
Right. And that comes with side effects too.
Well, there's not really a side effect of medicine. They're all effects. You hope for the one thing. They're not.
Yes, you're right. You're right. When
Eh,
you put it in that perspective.
Yeah,
Yes.
you take a pill, you get these things, and everybody's a little bit different.
Mm-hmm.
But the good thing is that despite all of the conventional medicine stuff that you experience, the stuff that you may be experiencing, there are alternative medicine and holistic remedies that can begin to offer relief pretty quickly. So I want to get into some of the simple solutions that you can implement right now that will start to change the trajectory of how you're feeling.
Yes.
I mean, it takes a little bit more than this, but it's gonna really change. And I think one thing is that overall, one thing that we have to do is just move more. And we don't gotta be no hit exercises. We don't go run marathons. That's no, we can say that for the 16-year-olds. But what you want to do is get into a routine where you do some gentle stretching or say some yoga. And that consistent practice starts to reduce chronic pain and get the lymph moving and
Mm-hmm.
body moving, and you start feeling better overall.
Yeah. Walking.
Walking's great.
Walking is great. I like what you said about if you're not one to exercise, but just to get started, those gentle exercises, and before you know it, you'll actually enjoy it, look forward to it, and enjoy it. So
It's a weird thing where I don't have time, but then you start doing it, then you make the time.
you
Yeah,
make the time,
I don't want to do it. It don't feel good, but God, it feels good. I want to do it.
right? And you don't even need to do it for a long period of time in the beginning. 10
No,
minutes, 15 minutes. It's better than nothing.
yeah. Eh,
So
Start slow. I think another thing that when you do these lifestyle changes, you can think about it just being more mindful. So some mindfulness type of activities, and it's just simple meditation techniques
yeah,
to release some of that emotional burden, some of that anxiety, just some of that mental stress and emotional stress that you feel. And good thing about meditation is like you don't gotta be perfect. You don't gotta be Buddha.
mm-mm.
You just gotta take some personal time and just learn how to just be at one with yourself and just let it go.
Deep breathing.
Deep breathing's great.
I love box breathing. That really works really good, and
That's the one thing we teach in our health
yeah.
coaching is part of it, the box breathing method, along with another one, Wim Hof.
Yes, those are really excellent ways to be mindful, and it actually
It
works.
does work.
Mm-hmm.
Calms you down really
Yes,
quickly.
yes, yes.
And so that's some lifestyle changes. I think also part of the whole lifestyle is how you tend to eat.
Mm,
So
that's a big one.
a big one. And so there's foods that cause inflammation. There's foods that reduce inflammation,
Yeah,
anti-inflammatory foods, and that's what you want to begin to eat. And that's right up your alley.
yeah. So a lot of people, and if you're one of those people rolling your eyes when I say you need to eat fruits and vegetables, because those are your anti-inflammatories, right? And whole grains, and drinking water, and drinking green tea, those type of things will bring down that inflammation.
No, you got to be honest with yourself. Like, how many vegetables and fruits do you currently eat in a given day? How many servings? And the answer to that question for 95% of people, it's probably one serving of vegetables if we're lucky. And that lettuce and tomato on a Chick-fil-A sandwich does not
Not
count.
count. No, no. And if people say, "Oh, it's so expensive," there's frozen vegetables, which you can get at the grocery store at an affordable price.
Yeah. So
If you
it's
don't have access to fresh, or fresh is too expensive, there's frozen
so easily done. Eat frozen. If you can get fresh, eat fresh. You can get organic. Just eat more fruits and vegetables.
vegetables.
You
Yeah.
start feeling a lot better.
Yes.
So those are some quick little wins you can do. But ultimately, how do you prevent disease? How do you overcome your health challenge and overcome any kind of disease you currently have now? Because really, 90% of the disease is diet and lifestyle. 10% is going to be more genetics. So we have the power. You have the power to overcome it. But what we got to do is think more long term. Because you keep doing stuff that you're doing now, it's going to be a snowball. So you're not going to have heart disease today, but 10 years from now, if you're living the same way you're living, that practices or lifestyle that promote it, you will have heart disease. But you don't have to go down that road.
If it runs in the family or is genetic, then what your actions today will turn on those genes.
That's a great way to, yeah.
All right. And what you don't do, if you don't eat properly, it will turn on those genes.
Yeah.
But if you eat properly, it will turn off those genes and make it dormant, so you don't ever have to deal with heart disease.
Yeah. Now everybody wants the magic pill, but here's the
That
thing.
doesn't exist.
It don't. But here's the thing. Yeah, it don't exist, but you don't need any magic, and you don't need a pill
Don't.
at all. So long term, what we have to do is get a comprehensive nutritional healing plan, and what that basically is, it's a ideally it's organic, but it's a whole food plant based diet. And I'm not talking going vegetarian or vegan, but core your core nutritional foods are plant based,
Yeah.
and it's not Impossible Burger.
Right. It's not the processed food, the hyper processed foods, anything that you get in a box or in a package wrapped in plastic. That's not what you want.
Because we go by the acronym called G bombs.
Right.
What are G bombs?
G bombs are your greens, your beans, your onions, your mushrooms, and your seeds.
So you want to eat as much of those possible on all your
Oh,
different
sorry,
meals.
I forgot the berries too. The
berries,
berries in there.
yeah.
Yeah, those are you. That's what you want to incorporate into your diet as much as possible every day. Uh, Try to get, and you could combine some of those. So, like if you're eating beans and you cook it with onions and garlic, you have three right there, right? And you have greens on the side and a salad, right? And that's how you do it. And for breakfast, you eat something with like some oatmeal with some berries and some seeds in it, right? You could knock that out in a day.
Yeah. One thing I've learned through my journey and through coaching is that life is a set of skills,
Yes.
and eating and lifestyle skills are a part of that.
Yeah. We lost our way over the years for convenience sake.
Convenience, yeah,
And
yeah.
everybody's working and nobody's passing on information. So everybody's just finding their own way to be convenient, right? And we lost our way.
Yeah, we
Because
have.
how did we, I mean, that was the lifestyle years and years ago, right?
Well, when we're little kids, that's how we used to do. My mom used to make all the meals at home, but now it's always out, and they promote how things are healthy, but it's all marketing and advertising to promote something that's unhealthy, trying to be healthy. It's not a good thing.
It's not a good thing. And then they try to sell you the idea is, I'll take the help from the store, make life easy. Nobody has time to cook. That's not true.
No,
You make the time, right?
let's make the time. Skills. It's
Yeah.
all skills, time management skills at that point in time.
Yeah, agreed.
So yeah, so you got all those different foods, but also some of those foods is that you want to incorporate maybe some supplements, but some spices like turmeric, maybe do some magnesium. But ultimately, you should be able to get all of your vitamins and minerals from the foods we eat. But initially, you may want to do a little supplementation during detoxing. That's probably when you really want to do some supplementation.
I think the only supplement that you really that you support on an ongoing basis is the B12, right?
B12, yeah.
Other than that, everything else you should be getting it from your food. And if every so often, I don't know if you would agree with this, but it's like if you want to check your blood work annually to see if there's um, anything lacking, then you make that adjustment, right?
Yeah, yeah, you gotta order the right panels and kind of see how everything looks like, and then you can always make the adjustment. And again, and you can get all your minerals and vitamins pretty much from foods.
Food, right?
Yeah, and that's what you want to focus on. Yeah, so that, I mean that's a good thing. You don't want to end all be all on all these different tests, but there are some tests you want to take, um, and that's, I mean that's a great segue because I think when you think about the tests out there, a lot of times it's blood work.
Mm-hmm.
Blood work also comes back so inaccurate, and it tells you a false sense of
Okay.
what's really going on. But
Okay.
there's other tests out there.
Because what you eat the night before, or what you could have been in a stressful situation.
Had an egg omelet, your cholesterol's through the roof.
Right. So that's not an accurate snapshot of what's going on with you, is what you're saying.
Yeah, just at that
Okay.
moment in time, but not long term consistently.
Okay.
So there's some other things out there. And one test I love is the toxic burden test.
Mm-hmm.
That tests for all different kind of main toxicities that we know, see what's kind of going on because those toxins can cause a lot of problems.
Mm-hmm.
You got hormone panels to see what your cortisol is, maybe your sex hormones, kind of see where they're all at. You can look at the gut biome, see how unhealthy any pathogens are there.
Mm-hmm.
Mold test, heavy metal test, all the things that can cause toxicity and cause sickness that a lot of medical doctors don't even test for that could be the cause of sleep or anxiety or stomach issues.
Right.
Yeah.
Okay.
And so that's really really huge. So when we're talking this good old game, here's the things you got to do. How can people find a health coach, which I prefer versus over a doctor per se in some kind of realm because like a lot of functional medicine doctors and naturopaths and allopaths, they're really big into, hey, here's a problem, here's the supplements, we can do this, but it's all supplements. It's like, well, no, let's get back on the diet and lifestyle 100%, and you don't need all the supplements. But how can you find that health coach to help teach you the diet and lifestyle skills to overcome that disease? What would you suggest?
Come to you.
Come to me. Well, I mean, I know we are kind of partial to our program. We think our program is awesome. It's stated. I mean, we touch about diet, lifestyle, mindfulness, sleeping, movement,
Positive thinking, everything. Yeah.
mindset,
Yeah.
psychology of things, and even we throw in the dental stuff because the mouth is health as well. But how can you find someone who's worth working with? What would you suggest? Because there's so much noise out there. You have any ideas? I mean,
I mean, you go online.
well, yeah, well, like
I mean, you do
like
your
like
research.
when you come across people who give you information, like what do they say and how they come across that catches your eye? So, my gosh, you know what? That's actually seems like quality information.
Well, if it makes sense, number one. Number two, if they say to do your research or they give you information where links where you could go see the different studies and find the information and look at their uh, their track history, their track record.
Mm-hmm.
Those are the things I look at
Yeah.
and see what works. And I mean,
Yeah. And just because you have a big following don't mean you're actually good.
no, not
There's
necessarily.
a lot of noise out there. And I think more, what I think about these days is that there is going to be a big value around relationships and helping people along the way.
Okay.
Traditional medicine, there's no partnerships, no relationships. Like you know your doctor's name, but they don't follow you and hold your hand and get you over the road bump. So I think one thing you look at is just their philosophy when it comes to help coaching you and the support you get is really, really big.
There's, I mean, that's true.
Yeah.
But I mean, to have a health coach alongside with your current doctor, you have a team, right?
Mm-hmm.
Your team includes the chiropractor, your masseuse, which really is important, your dentist, your health coach, and your regular doctor. and it's like you're working together as a team to help keep you and keep you on the straight path to health.
I think you nailed it right there. The health coach is your person who's teaching you how to play the life game. That way you can effectively work with that team of other doctors
Right.
to ask the right questions. To when you see a study, is not to take it at face value, but to realize, hey, you know what? Let's just assume that what they said is not true, and let's see if we can hold up to all the scrutiny against it.
So you don't take everything what the doctors say verbatim.
Ask for tests and studies always. What the evidence go towards?
Right.
What are those side effects? What are the effects? What's the statistical chances of me improving the outcome of my quality of life? Is it 2%? I mean, like they take a statin drug, you get like a 1.3% reduction of having a major cardiac infarction. Is that really worth taking with all the side effects? Only you can really determine that. But I think one thing as you go along that path is really understand what the qualities are you're looking for. And as you do it, you want to journal. We're really big on journaling.
Yes.
You want to make sure you track all the symptoms and just identify patterns for improvements and things that are working and not working.
That makes sense. I definitely keep a journal. I'm a journal junkie too.
Yeah, well, because I think about my journey back in like 2017-ish, whatever it was. Best friends, two brothers died at the same time.
Yes.
I was kind of overweight. I thought I was working out pretty hard, but I was going down that road of just feeling sloppy, not confident. So I didn't feel sexy in front of you. Um, and like, okay, well, I got to do something. So I tried to change some stuff, and it's still been a little bit improvement. But then one day where I just couldn't jump out of the pool or in the pool and throw my toe up, I was like, that's it, And ever since then, I think around 2018, just changed, my movement activities, my food intake, my lifestyle, my mindfulness, my movement, my oral. I always did about my oral health, but just always try to get better and better and better, and that's what it's about. And we see it all the time with people we work with and talk to and interact with our friends and family. It's just you see that struggle, and you kind of raise your eyes, like, hey, you ready to do something about this?
Yeah, yeah. A lot of people always think it's going to be so painful. As in anything, that's different to get started. It's not going to be easy, but once you get going and you see how amazing you feel,
It's
why
worth
not
it.
do it? Yeah, it's more than worth it.
Yeah, it's totally worth it. Not only worth it in terms of how you overcome your emotional burdens, so you get your gain mobility, just your overall quality of life just gets so much better.
Better, yes.
But talk about all the money saved on medical bills that you, that
You can go on
you,
vacation with that.
you go completely.
Enjoy yourself, right? You could live reduced stressed life because a lot of times people are stressed about how they're going to pay those medical bills. Majority of the time,
Yeah.
right?
But well, think about this, man. Like Ozempic, there's better ways to lose weight.
Yes.
And there's people who spend $15,000 a year on Ozempic, and after you stop it, they usually gain the weight back. And so, what do you have left over from that whole experience of a year?
Oh my gosh, and not to mention the effects because they're saying that some people are having like bone issues.
Bone issues, muscle issues. I mean, you lose all kinds of weight. The face is going on. Yeah, so you get all that going on, and so the only thing that you gained, or you left over, is the fact that you're $15,000 poor.
With other health issues.
And that's why holistic healing remedies, it's they're so powerful. And let me make this completely transparent. It's not about rejecting conventional medicine.
Yes.
It's really just about enhancing your own health journey that complement your lifestyle, and there's just a natural way of life. You gotta take back control of your health. That's what you gotta
You
do.
have to. You have to take control of your health, take control of your future, and not go down that path. And it's so easy to make those changes. They wouldn't. I don't want to say it wouldn't cost you much, but you can get started right away. Is what I'm trying to say.
Yeah, I mean, they're going to be an investment, but what's it going to cost you in the long run? Because it's going to happen. A year's going to go by. So, irregardless of what you do, are you going to continue down the same path, which you know is not working, or are you going to try something that works? I mean, I want to say 100% of the time. I mean, it's 100% of the time. You do it properly, it works. After a year, where will you be?
Right.
But ultimately, it comes down to I'm big on informed decisions.
Yes. Agreed.
Ask questions, talk to your doctor. If they want to do treatment, Ask the right question about outcomes and probability and side effects, and then you weigh it against more of the holistic stuff and what the side effects may be and cost, whatever it may be. But you got to make the informed decision because ultimately you want to become your own best doctor. That way, when you can become your own best doctor, the medical doctors, they're less needed, and you only need to go to them when you truly, truly need them.
Agreed.
So make sure like, follow that advice, and when you go to look for a certified health coach, make sure you do practice it with the help because there's so much information out there.
Yes, it can be confusing,
It's confusing, but see, if
contradictory.
yeah, but information was good enough for alone to do something, everybody will be healthy.
Right.
So it's more than just the information. No, it's know how to implement the information.
It's true. That's true.
So
So if you're struggling with chronic pain, unresolved symptoms, or emotional stress, start your health journey today. Subscribe to our channel for more practical, holistic health solutions.
yeah, below there's a lot more information. So take a look there. Share your experiences, your questions, your comments. We definitely love hearing from you. We want to build this supportive community together. So yeah, it's a good one. Hopefully you learn something from it.
Until next time, be well.
Yeah, take care.